And I don't say that lightly. I've said that a couple of times since the bill was introduced. And I thought perhaps that sounding the alarm would stop it from happening or at least slow it down. It didn't. And so there are going to be people who suffer mightily and families that lose a loved one and people who will die. And it's all because they want to provide a massive tax cut for the wealthiest people in the country. I don't understand the thinking.
First of all, the only people that we say should not get free government health care benefits are illegal aliens and those who refuse to try to even look for a job. It's very common sense. We want, and look, we are going to bankrupt this country if we keep on giving the people's benefits, the people's Medicare, Medicaid, and Social Security benefits to illegal aliens who have no legal right to be in this country and never paid into the system to begin with. That is never the design of those programs, is to give them to every person all over the world. They ought by right to belong to the American citizens who paid into those programs to begin with. And that's what we're fighting to make sure happens. The other representatives here worked very hard on this to make sure that a lot of our rural hospitals are struggling because of some of the policies of the Biden administration. So what we did is we put a lot of resources and a lot of changes in regulations to make it possible for our rural hospitals to stay open despite what the Biden administration did to them for 4 years.
As we'll discuss today, the One Big Beautiful Bill Act does include a $50 billion rural healthcare transformation program intended to support rural hospitals and providers. But I think we would all agree that when we're talking about $50 billion out of $1 trillion in cuts to Medicaid, that is woefully inadequate. Nevertheless, these funds are critically important to rural hospitals and providers in this room and across the state of Illinois.